Okay, welcome everybody and good evening to our Tuesday evening call. We call this the LifeWave introductory call. It's a great call for people that are new and learning about LifeWave. We share a little bit about the history of the company and the technology, this historic breakthrough that we have, and the star of our show is X39. So we'll be getting into that. And then I invite one of our doctors on this evening. We have Dr. Walt, a acupuncture physician, an AP from Colorado, is joining us this evening from New Mexico, I believe, tonight. And we want to make sure you're on. So raise your hand, Dr. Walt, because you are on a different type of device this evening. So let us know so we can promote you. Oh, we already did. Thank you.
I'm on.
Okay, great. Gregory already did it. Great to have you. So, so then we'll have Dr. Walt come on and share a little bit about the technology, and then it's your turn. You can ask questions, you can share your testimonials. I hear we have a good one tonight, and we love hearing your stories. It's the stories that make such a difference and giving people hope that the future can be different with this amazing technology. This company has literally changed my life, and these products have changed my life. And so we're going to learn a little bit about that. Let me get started. So first of all, I want to talk about a little bit about the history of the company. LifeWave is 16 years old. It started in 2004 back in San Diego when David Schmidt was on contract with the government to create something for sustainability for the Navy SEALs to help them stay awake in their mini subs for days on end sometimes, and created something in photobiomodulation. And we're going to talk about that in a few minutes. And it's a patch that actually is non-transdermal. Nothing's going into the body, but this particular patch called the Energy Enhancer accesses 500 calories of body fat and turns it into pure, clean energy. Well, the patch got discovered by athletes, which was pretty exciting. And one day, the company changed when David Schmidt, our founder, got a call from Richard Quick, who's the women's Olympic swim coach at the time. And he said 6 of my 8 swimmers did their personal best. Well, the news got out and the patches got out, and there was all kinds of exposure in the media, questions of doping. They found out nothing was going in the body. So athletes all over the world in just about every kind of sport are enjoying enhanced strength, stamina, and performance and reduced recovery from that patch. Well, David's an inventor, and we're going to talk about David in just a little bit. And he kept working on it. He also noticed that there are some pain relief benefits out of that product, and he tweaked it a little bit, and IceWave was born, which is our pain reducing patch. And we do have clinical studies from independent labs that prove that pain is either rapidly or instantly reduced in the vast majority of people that try it. It's very exciting to have something simple, natural, affordable, and effective. So the first phase of the company was pretty much what we call the symptom phase. So we had the energy enhancer and the ice wave, and then the sleep patch that increases your body's melatonin. And hospitals in Europe actually use that instead of sleep medication. So that was phase 1. Phase 2 of the company was more of the anti-aging phase. And anti-aging was like putting the brakes on aging. And eon, glutathione, and carnosine were born, and they have many amazing benefits. We're not going to go into the details of the other patches tonight because we're going to talk about the star of the show, which is in phase 3, which is the phase called regeneration. David has been studying for, over 10 years regenerative science, well, probably longer than that, and really wanting to just enhance the human condition, increase people's, just experience of living in a body and actually turning back the clock. So January of 2019, launched to the world was X39. And it was David labeled all the patches with a number, but this one stuck. Everyone else got a name, but this one got It's the 39th patch. We don't have 39 patches to the market, but there were 39 patches. And X39 actually does many, many things. So I'd love you to take notes. If you're brand new, you especially want to write this down, to write down GHK-CU. That's the copper peptide that gets activated by the patch. And again, we're going to talk about this in a few minutes. So I want to kind of transition a little bit into David Schmidt. He is our founder, our CEO, our inventor, and a very, he likes to call himself a humble inventor. He has over 100 patents and patent pendings to his name. He's quite accomplished. And the fact that he was able to crack the code of this copper peptide, he is becoming known all over the world in scientific circles, because the billion-dollar companies have tried to activate this peptide unsuccessfully, and he's done it. And it does many, many different things. We only talk about what we have clinical proof for. David loves the research, and he, you know, like Gregory likes to say, other company owners want the bigger boat, the bigger car, the bigger house. David wants to spend more money on science and research and validating what he's discovered in the lab. So the company has invested millions of dollars into clinical studies. And at this time, we have over 90 of them validating the efficacy of the patches. And like I said, he has over 100 patents and patent pendings. Well, the government, you know, that phase changed. LifeWave was born in 2004. X39 was launched to the world in January of last year, and the company tripled in size. So a 15-year-old company tripled in size in 1 year, which is quite unusual. And it's because of this historic breakthrough that we have in the patch. So what I'd like to do is invite Dr. Walt on and introduce him a little bit to you. He is, like I mentioned, an acupuncture physician out of Colorado and New Mexico. And he started out, and I want to make sure I get this right. He started out, he was doing pre-med in medical technology, and 4 years later, he also became a nurse. And then he worked in emergency and ICU, and lately interventional radiology. So in 1990, his life took a turn, a significant turn. He was deciding, do I go the direction of pathology, or am I going to go to a totally new direction into traditional Chinese medicine? So he took a trip to Beijing, and he fell in love with Chinese medicine. So he became a nationally accredited acupuncture physician in Florida and practiced there. And he continues today in Colorado at the Boulder Community Healthcare in their integrative center on cancer patients. He also has a private practice in traditional Chinese medicine. I love what he says. He says, as a practitioner, we must continue to keep up to date with new research technologies that bring non-invasive, zero side effects that are economical for patients and clients. And practitioners have an obligation to be open and to share research technologies that take our patients to a paradigm shift in their healthcare. So it is my pleasure to welcome Dr. Walt. Love to see you. There you are. Hey.
Hey.
All the way from New Mexico tonight.
Yes, and I'm on my iPad, and I know I'm looking one way, but I can see you.
Okay, well, we're really glad to have you. So before we jump in, Dr. Walt, as an acupuncture physician, you got introduced to LifeWave, you know, not all that long ago. And what is it about LifeWave that attracted you to incorporate that with work with your patients?
Well, I do have to tell you something. I really got introduced to LifeWave in 2006. When I had my practice in Florida. And what got me interested was the fact that David was aligned with traditional Chinese medicine and the energetic
Very much
side.
so. Yes.
So Dr. Liu called me, what was it, about 6 months ago, and said, "Have you heard of LifeWave?" I said, "Oh yeah, of course I have." And she said, "You had, why didn't you tell me?" And I said, "I didn't know you wanted to know." And she said they have a new patch called the X39, which helps activate stem cells. And I just said, "How do I get started again?" You know, that was it.
That was me too.
Yeah, just like right away. And that's how I got started. You know, I understood, you know, the research and the background. So it was very easy for me. I didn't need anybody to convince me.
Well, same thing happened to me because I'd been researching stem cells and for injections because I had some knee pain from being bone on
Mhm.
bone for a long time. And I was ready to put out $12,500 for an injection with no
Right,
guarantee. And then a friend called and introduced me and I said, how fast can I get it? So
right,
you and I are on the same, we didn't
right.
need anything else.
And
Well,
to
Walter,
answer your question, the
yeah,
reason I jumped on it is because,
yes.
like I said before, it's non-invasive. There's really no side effects that I worry about, and it can work pretty quick. And that was a nice thing, because the economics of it, and especially today in the environment that we're in, it's very important for me to have something to offer my clients, in those three areas, and economics is a big one.
Especially now, always, but especially now. Thank you so much. So
Hmm.
let's jump in and share with people about this technology because it's kind of a mouthful, but it's
Right.
a science called photobiomodulation. Could you please explain to people what that means?
Sure. I'm going to go back a little bit. Um, Light therapy has been around forever. If you think about the sun is life, and the sun also shoots out its rays, frequencies, and our eye picks up that frequency. And because that frequency enters our retina, different biochemical reactions happen inside of our body. So David took that knowledge, and what he did was, in the patches, there are certain crystals, minerals that react to your body heat, which is like a light, and it's bounced back into your system and gives a message to your body to start to activate or create something. It's a very simple, I really would love for people to read about light therapy, light medicine. I was using light medicine way back in 1999. A simple, real simple thing. There's machines that have it, but I have like patients that have like viral infections of their skin. When you shine purple light on it, something happens to that virus. The itching, the pain goes away. So that's also biophotomodulation. You're modulating something in the body, just like you modulate your voice. It goes up, it goes down. So this has been around a long time, and he's just really creative, and what a genius to develop this within the patch that helps our body. But it's our body that bounces that back and forth and creates and activates the GHK copper peptide that is almost like a food for your cells. And those cells decrease in time as we age. And so once you stimulate this peptide, it's kind of like a food for these little guys, and they get started and they know exactly where to go.
Well, you are jumping into the next question. I love it. So we're
Oh,
transitioning. No, it's perfect. It's perfect, Dr. Walt. I love it. So you explained the photobiomodulation as a form of light therapy, like the sun when it hits our skin and a biochemical change happens. It's the same kind of thing that happens with the patches.
right.
So could you go into a little more detail about some of the benefits of what happens? What do we have scientific proof on that happens with this X39 patch that activates this copper peptide? What else does it do? It activates stem cells. What other benefits does it have?
These little stem cells have the benefits of, one of my favorite things is wound healing, rapid wound healing. So people that are post-op should be able to have these and use them. It helps with stimulating the repair of tissue in your body. And we all need those, that constantly, because the stressors of our life will really break us down. But these little guys go back to, helping you regenerate everything. Um, there's a lot of, some of my clients have said their vitality and energy has gone up. But one
Mm.
of the big things for us is the fact that pain and insomnia, you need to get rid of those two first so you can heal. So when clients come in pain, I simply just put the patch on them without sticking it on them, and they get a pain reduction. So pain reduction is another thing that can happen with this patch. Um, so it's really an activation of your whole body, and sort of like putting the stops on the aging process. Your skin, you'll see things within your skin after a couple of months. Some people a little bit sooner because they're a little healthier, eat better, they're not doing drugs, all of those things. So it's an overall healing of the body.
Beautiful. So in helping educate people that are new, it does many, many different things. And again, we recommend everyone research the copper peptide. We have clinical proof for many things that it does, and it does many more things than that. That's why it's referred to as the holy grail of health, healing, and regeneration. So it was a major, major accomplishment and breakthrough for David to discover. And for those, let's see, I have my book handy here. I should have pulled it down. This book is
Mm,
the book from the guy who discovered the peptide, Dr. Lauren Picard. And it says for skin and hair beauty, resetting your genes to youth. And there are, what, over 4,000 genes that are reset? Is that what it is?
that is correct.
Okay.
It'll start to
So
reset.
could you explain a little bit to people about how you use the patch?
Myself or on my patients?
Just what's generic usage instructions for people to have them be most effective?
So number one is the back of your neck, kind of like on your C7 in the back. That's where I have mine on right now, or about 3 or 4 inches below your belly button. I tell my clients that they need to drink a lot of water. You need to hydrate. These guys need the hydration, and wear it for about 12 to 14 hours and take it off, so that there's the attenuation. That's a medical term. So your body has a little bit of a rest, just like we need to rest at night. So your body needs to do a little bit of a rest. And I tell people at least let's give it 3 months, the X39, because people, Americans want to see things very quick, and they will see things, they do see things, but let's give it at least 3, 4 months to really show you what is going on in your body. And there's some people some people have said to me, I'm not feeling anything. Well, that's a little different situation. Maybe there's something deep down in your body that is being addressed that you didn't know that you needed addressed.
Well, like you said earlier, stem cells know exactly where to go. They have this
They do.
innate wisdom to find those areas of greatest inflammation or, what is most life-threatening. I mean, when I started, I had pain in my knee and I wanted my knee to feel better.
Right.
Well, I did have lung damage from the past, from pneumonia several times and chronic lung infection. So my guess is it went to repair my lung cells first because that was more critical to my life than a sore knee.
Right.
And I don't
Right.
know, but it's probably what happened.
That's
And
probably is what happened. Yeah, definitely. Yeah.
yeah. And then over time, there's subtle changes that happen. And for a lot of people, hair, skin, and nails, like you mentioned earlier, because, collagen increases, which is pretty exciting for a lot of people. And I tell people I'm not so afraid of my magnifying mirror in my bathroom anymore. I, but then fun things happen that are totally unexpected. If you have scars, what do you notice happens with scars?
Oh, the scars, especially people that form keloids, which is excessive proliferation of the skin, and they usually have a bump. That starts to go away, and scars start to go away. I have a patient who's post-op knee repair, and I think you know her. She's amazed. Every time she sees me, she comes in and she says, "Look at this scar. Can you believe this scar? It's only a month old." And I said, "Well, that's what I told you." So she's enamored with the X39.
My orthopedic surgeon was, and he was pretty intrigued, shall we say, when he noticed how quickly I healed. He goes, "You're not even going to be able to see that scar." And it's a
Yeah,
big one. But one of the
yeah,
fun things that happened to me, aside from, hair, skin, nails, was really amazing. The knee pain went away in a week. I put the patch
yeah.
here. I wore it for 90 days before any of the other patches. And then
Uh-huh.
what was amazing is the knee pain went away in a week. And I went, what? It didn't make, I didn't understand what I know now. And then, fun little things like an injury from 20 years ago that left me with a deformed finger that was stuck in this position can now straighten out.
Right. So,
But
it's important that people really understand that biophotomodulation is real. It's been around for a long time. We're just now in the natural world, because of LifeWave, have the advantage of helping people with stem cell, activation.
Yeah, it's so wonderful to be able to give people hope that their future can be very different, and that as we age, we actually get younger. So it's it makes it really fun.
Right.
So I'd love to turn things over to some of the questions, unless there's some other things you want to share with people.
No, that's good. The questions are great.
Okay. Well, since you brought up light therapy, Jim and Victoria would like to know, what is a good source for light therapy? Because you say it would be great for people to get educated.
There's a couple of books. There's one book that's called Light Medicine. I forget the author's name, but if you just look up, light medicine, there's a lot of different types of machines. The machine that I have is from Europe. Of course, it's a challenge to be a pioneer. Every one of you are pioneers on this call, but you're in the right place at the right time. I had started to be a pioneer way back in 1990, and it was a challenge. And when I bought my first light machine, all of the other physicians in the practice, they thought, "Uh-oh, he's gone cuckoo," But light therapy, I understood it. I don't know if it was my mixture of Western and Eastern background, but it's here to stay. And we have the only product on the market that can do this with the photo biomodulation.
There is no competition.
No competition.
We have patents on our products. We're protected. No one else has this. We don't have to say mine is better than yours and whatever, because no one else has it. So,
Nobody.
going back to the Chinese medicine world and David's fascination for a long, long time with Chinese medicine and the energy system of the body. You mentioned it needs to be well hydrated. What do you have any good references for people? This is from Jim and Victoria again. They want to know, good references on acupuncture points.
Oh boy, there's so many books on acupuncture points. I would just, Google that. Google acupuncture points or beginner's guide to acupuncture points. But don't make yourself crazy with that, because there's over 700 points that I had to learn, and combinations of those, go up into the hundreds of thousands. And I don't want you to get crazy on this. Just follow, what we teach you, and keep it basic, because even the basic, the KISS rule, keep it simple, stupid. What we do is very, very intense with these patches. I'm not going to get into all of it, but we even have the three patches, the SP6, the Nirvana and the Alavita, that are called the brain patches. And that really interests me, because I've had 6 strokes and, doing well. So it's because of the knowledge that I know and I have in both of those sciences that kept me well and, up and running around.
You said something really, really important. We, as distributors and customers and guests that want to try the patches, we don't need to know acupuncture points.
Now,
Every patch comes with a little instruction booklet, and it shows you where to put it. And
right.
so that if you follow that, you can do great. If you want some more sophisticated protocols, go to a practitioner and let them help you. But the beauty of
Exactly.
the patches is, X39, it really doesn't matter where you put it, does it?
It doesn't. You can put it anywhere. That's true.
And,
And,
and
and
yeah,
I had that video that I sent to Dr. Lou, but I was cooking and I moved pretty fast and I sliced my finger. So I put my patch right a little bit distally, about right here, on my finger. And it was a good, I probably needed about 2 or 3 stitches, and it was bleeding. I mean, I have a video of it. I, within a minute, felt a tingling there. And within a couple of more minutes, it stopped bleeding. And my finger never ever was swollen. I could compare it with the other one. There was no tenderness I could hit on that area. It was very amazing to me. So when you see that, I could, it's amazing. So just be very basic with the stuff. It's wonderful if you want to look at, a basic guide to acupuncture points, but you don't really need it. But I'm happy if you want to do that also.
Yes, yes, yes. So that's what you said about the wound healing. It's probably the most dramatic thing that happens
Oh,
with the patches. And I tell people, you don't need to hurt yourself to get a good testimonial, Dr. Walt.
no, 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 I wasn't intending to do that.
I
cut-
know, I
I
know,
was
but
cutting
you don't forget
broccoli.
it either.
Yeah.
It is quite amazing, and we've seen, you can look at before and after pictures, and they're dramatic, especially for wound healing. That
Yes,
is one of the most exciting things, and we have lots of places where you can see some of those. So I'm just in awe of that, and it just keeps getting better. The longer
it does.
I recently had a surgical procedure. I did actually end up having to have a knee replacement, even though the pain was gone. But I had been bone on bone for so long that my leg
Hmm.
was deformed, and I would have lost my ability to walk if I didn't get a new knee. So I got a new knee, and my first knee replacement was not pleasant. I'm not going to go into detail, but the second one, um, well, the first one I was on narcotics for 4 months and I was in pain, and then PT for a year. They had to kick me out because insurance wouldn't pay anymore. The second one, I got rid of my walker and off my meds in 3 weeks.
Hmm.
And
Very good.
so the dramatic healing power, and even my orthopedic was amazed. So I was very, very happy. So if you know anyone that has an injury or a surgical procedure, a friend of mine yesterday had a tooth extraction, and the dentist was like, "You hardly bled." It was like she was shocked, and
Yep.
she's
That's
healing
exactly
really fast. So it's
right.
wonderful.
Right.
Wonderful. Let's see. We have a question here. We hear some people refer to the patches as nanotechnology. Is using that term true to patch technology?
Sure. I would call it nanotechnology because it's all within that little area on the patch that's, less than the size of half a dollar. So yeah, I would call it nano.
Okay,
Absolutely.
great. And Helen is asking, have you seen it be helpful for joint pain all over?
Yes, I have. And you might need more than just one patch. Besides the X39, you might need something like the energy enhancer. Just a real quick thing on the energy enhancer, that will open up the meridian system, unblock. If you're having pain and you're not sleeping well, you're not going to heal. So you got to get rid of that pain. And usually, when you get rid of the pain, you probably will heal and sleep better, and then you'll start to heal. But you could use more than one type of patch.
Are there certain spots for overall body pain, Dr. Walt?
Well, I like to use the bottom of the feet, the kidney 1 point that we show, or up here on your chest, the lung point. I like those. Sometimes you can put them in your back, on either side of your back, just below or above your iliac crest, the bone, your hip bone. So it just depends. So remember, the tan is on the left and the white is on the right. That's
Yes.
important.
Yes, there's two patches that have a two-patch system. The rest are
System.
singles. So
Right.
Energy and Ice Wave are a two-patch system.
Right.
Okay, great. And let's see, here's a question again from Ravel. She says, which patch for disc discomfort?
Well, again, you could have your X39 right at the disc, but then you want to unblock any kind of pathways, and I would use the energy enhancer. Now, if you're in severe pain, you might start with Ice Wave, and that's pure unadulterated getting rid of the pain. But you do want to have that X39. That's the premier one. That is going to help you. Your stem cells need to be there to start to get rid of any damage. And remember, you might go through a little bit of a detox because it's trying to get rid of what doesn't need to be there anymore, and that flies through your cardiovascular system. So that's why you want to drink water. And if you have to, and you don't feel comfortable, some people will go through like fatigue or headache, or there's been cases of diarrhea, just not feeling well. And you take the patch off, put it on for 4 hours, and take it off, and then put it back on. Or ask any practitioner that you know that is using the LifeWave technology what you should do. You don't have to go at this alone. You got a lot of people around you.
Wonderful. That's really helpful because sometimes people can have an experience where it's not as pleasant right away as we want it to be. And
Right,
so the beauty is you're not put, just like you said, you're not putting anything in your body. So you, if the, like I had, an old injury get reactivated or retracing to get fully healed, and I had some acute pain. So just took the patch off. I mean, I had it here. I took it off and the pain went away here. It was
right.
amazing. And you build
Yeah,
up into it, right?
yes, build
That,
up into it.
that's really good. And could you address when people don't notice something, what do you share with them?
I share with them the fact that those stem cells, those mother cells, are being directed to somewhere in the body that needs attention. And that may not be your lower back pain or your beautiful skin. Um, Give it some time. Let's see what's happening. Something's got to happen.
Yeah. So the people that typically notice it are people that have a lot to notice,
Yeah,
isn't it? And the people that are really healthy, that may take a little longer for them to notice, right?
right. That's exactly correct.
And then those subtle changes. And we have a wonderful health tracker. So you can actually watch things over time because, like you said so beautifully, and I quote you all the time, Dr. Walt, by the way. Um, I ask people, one of the first things I ask them, are you in pain? And if you are, what level? And how's your sleep? And, those things need to be addressed first.
Right.
David did a wonderful product training on pain management, and he talks about 4 different patches that actually help. So,
Hmm.
the X39 and Ice Wave are 2 of them for sure. Okay, well, we're at I can't believe we're at the bottom of the hour already. Oh my goodness. Well, let's see. Jim and Victoria, did you want to say something? You had your hand up. So let me unmute you. So you have to unmute your own line. Did you want to say something, Jim and Victoria?
Yes, I have a question other than the ones that we,
Okay.
The ones that we bombarded you with.
Yes.
um,
And before you ask, remember that we don't mention any disease states. We're not here to diagnose, treat any illnesses, symptoms only, please.
yes, I know. Um, sorry for all the questions, but I've had several come up in the last couple weeks that I wanted to ask. But the one I wanted to ask on screen was because it was too long to put down in a question. David had said something about you can put the X39 anywhere. He says, however, it may be just a mental thing, that you just think it might be doing better if you put it on whatever you want uh, improvement in. And but because their studies show otherwise, that no matter where you put it, it's going to work. I had a thing removed by my dermatologist in my arm. It was a hard bump, and he looked at it and he cut it out with a circular punch type thing, and it came back that it was precancerous or cancerous or whatever. But anyways, he said he got it all out anyway. But the healing of it, once it started growing back in, the hole that he left was a kind of a medium red color. And it stayed that way even though I'd been on the X39 patch for a month and a half. It stayed looking like that. And there was still a little bit of a dimple when you rubbed your hand across it. I decided one day to put it on the spot itself. And within one day, there was a huge difference. And so I did that for 3 days, and it's acting like it's healing a lot faster. And and I'm kind of wondering why that is. I mean, since David seems to think that it's psychosomatic, that you can put it on something, and I'm not trying to contradict David, but I'm just kind of wondering, is it, is there just, is that real? Is that a real thing, or is that just in my head?
No, I don't think it's in your head at all. I think proximity to any injured area is true. For instance, when I cut my finger, I put it in close proximity. So those stem cells are going to be activated, and they're going to go right to that site because there's a lot of other chemical products and they're like cytokines that identify that I need help here. So the proximity is fine for you, and it's not in your head. The reason that we put the patch, the X39, on the back of the neck around your C7 in the back is there's a meridian, a main meridian that goes down your back, and then it comes up around to your belly button and continues to come up, and it ends up about right here. About right here. So that's a reason why we do that. It's a major acupuncture point, acupuncture points that divide the body in half because we're bilaterally symmetrical. Okay, so that's why we do those two areas. But proximity to any wounded area, you will see a very fast healing activation. I've seen it.
Great, great. Okay, Rhonda has a story she wants to share if you're willing to hang out with us a little longer,
Yeah.
Dr. Walt. Okay.
Hi,
So,
everybody.
hi.
Hi.
So I thank you, Dr. Walt, for everything that you're teaching today, and you, Robin, as well. It's awesome. So today I get a call from my daughter. This is my little testimonial. And she says, I have a medical emergency. I think I need to go to the doctor. And she's describing pain in her abdomen, in urinary tract, those things. She's just said, just everything hurts. I can't move. I'm in so much.
Oh,
If I could come here to the doctor. And so she goes and sees a doctor, and we come back home, and she's waiting for her prescriptions. And I said, did you try the Ice Wave patch? First I asked her if she had her X39 on, and she said, yeah, I have one on my neck. And I said, okay. And I said, did you try the Ice Wave? And she said, no. And so we stuck the Ice Wave on one on the back where her kidney is, in the back on there, the tan one, and then the white one probably about 2 to 3 inches below that. And we did it for both kidneys, just as I didn't really have you, Dr. Walt, then to ask where I should put them exactly. But anyway, so we did that. And then I said, why don't you just stick an X39 just on your abdomen and see what happens? And she did that. And within a couple of minutes, she was like, I cannot believe I am out of pain. I have been in so much pain all day, and I'm completely out of pain right now. And so that was pretty amazing.
that is amazing. One thing I'd like to add, and I don't know if she did it, the pain is body telling you something. I would really highly recommend that she gets some kind of, check out to see what that pain was from.
She did go, I do know what it is.
good.
I'm just not saying what it is on
Yeah,
here because we're not supposed to talk about, but
Right.
yeah, she got a medication for that as well. So
Perfect. Good.
yeah.
Good. I think I
that
think I
just
know what
stopped
it
the
was. But
spasming.
yeah. Yes. Good. Very good.
Yeah. And then one little quick other thing, my mom has inflammation in the joint in her foot. One of her toes is kind of turned, and she has some issues with that. She came up for Christmas and was in major pain in her foot just from having her shoe on. And she took her shoe off, and my daughter actually patched her with the Ice Wave. And she said within 5 seconds, all the pain in her foot was gone. And so that was a quickie too. So pretty amazing. Thank you.
That is sure. Thank you. Thank you.
Okay. Well, I want to thank everyone. We've gone a little bit past our time, and I want to thank you, Dr. Walt, always. I love learning from you. It's so much fun for me having my doctors in rotation because I get to learn.
Can I
Yes,
say one thing?
yes, please.
I don't know if this is appropriate or not, but Judy had texted me, and on Nitty Gritty 101, she's put in a patch protocols where to put patches. So that might help people also.
Yeah, I will type that in the chat so everyone can go there It's a great resource for everyone.
It
Okay.
is. It really, really is. Yes.
Yes. And it's one of our leaders, Judy Daniel, created this for her team, and she's been sharing it with everybody. And we're so grateful until our training website comes up. So it's called nittygritty101.com. And we do record all of these. So just know that on liveyoungeryoutube.com, this will be available tomorrow. And you can look at the past ones also. So let me clear my throat for just a second. Okay, so I get to thank everyone for being with us. Dr. Walt, a pleasure
Thank
as
you.
always. Enjoy your time down there in New Mexico. And thank you all for taking the time to be with us live and on Facebook and watching us, however you're watching us. If you're brand new and someone invited you, please get back to them. And they can help you get started. We have a wonderful customer program. We have a great program if you're the kind of person that likes to share. There's a wonderful and very lucrative compensation plan that goes with it. And like Dr. Walt said earlier, the timing to be involved with LifeWave is magnificent. We're with a company at the early stages of hypergrowth, and more importantly, we get to help change lives all over the world in over 70 countries. So thank you everyone for being with us this evening, and we'll say good night.
Good
Bye-bye.
night.
Thank
Bye.
you.